Hi, my name is Dr. Stacy Shropshire. I'm the owner of Evolution Body Transformation. We're a med spa in Monona. I'm with the fabulous Jodi Radtke, and today we're talking about common misconceptions that occur in the aesthetic industry. I think the number one thing is one size fits all. One device does everything.
Yep. And one device does not do everything because there's different modalities for different things. Mm-hmm. You know, you have your IPL, you have your Exion, you have your BBL, you have, you know, your ablative CO2 laser, you have all of these different things. And so every modality is different and every person is going to require different things to achieve what they want to achieve.
Well, at the end of the day, what we're really trying to do is make someone's skin as healthy as it can, because healthy skin looks pretty.
Mm-hmm. Right? Yeah, absolutely. I mean, it is, you know, skin health is I think the most understated thing in this aesthetic industry. Mm-hmm. Healthy skin is just that, health.
Right. And skin is, you know, it's an organ, right? So it's all around us. It's our largest organ that we have.
Mm-hmm. Yep.
And so if there's internal problems, that can come out on the skin. So we also have to look at the person's health overall,
right,
and address that in accordance and factor that into the whole protocol. Mm-hmm. So there's different things we can add in to help the skin barrier, like dermaplaning, right, would be a great.
Yep. Treatment. So dermaplaning is great because what that's doing is that's just kind of removing that superficial hair and giving you a gentle exfoliation, mm-hmm, which then helps your skincare products to penetrate better.
Right.
Because you're not dealing with that hair and that dead skin on the surface. It is kind of like a clog.
Well, it's a barrier. Our skin is a barrier, right?
Correct.
It's meant to be.
It's meant to keep bad things out, right?
Absolutely.
It protects us from environmental factors in penetrating our vital organs that are inside.
Right.
But yes, you know, the barrier is huge. If your barrier is off, you're going to be sensitive, you're going to be red, you can have breakouts, the barrier is really the key to balancing, mm-hmm, you know, that skin health.
Yeah. So what would be some things that people could do to improve the skincare barrier?
So it's all about maintenance at home, using really good products. And again, every patient is going to be different. You know, mm-hmm, some people have very sensitive red skin. Other people have, you know, thicker, oily skin. So depending on, you know, what we're dealing with depends on what cleanser we would use, what active we would recommend, what moisturizer we would recommend. Are we doing, you know, a retinoid or a true tretinoin, or are we doing, you know, what are we doing at night? Sunscreen is crucial. That's vital. That's not negotiable. That's non-negotiable. But what are we exactly doing to help strengthen that barrier?
Mm-hmm. So a lot of people think about wrinkles as you age, mm-hmm, right? But there's a lot of different things that happen too. The texture changes dramatically. Mm-hmm. We lose muscle, bone, fat, everything elongates.
Gravity wins.
Texture takes over.
Mm-hmm.
So if somebody was going to incorporate different products in their routine to help that, what would be a great just starter product just to get in somebody's routine? We mentioned sunscreen, of course.
Yep. Really, you know, a good active, a good vitamin C.
I was hoping you were going to say that.
A good vitamin C. And you know, vitamin C varies, right?
Right.
So, you know, you have your drugstore vitamin C, that the second that you open it, if it's not L-ascorbic stabilized, it's no good.
Right.
And so I think that's a great point to kind of talk, mm-hmm, about what's dispensed in our med spa,
right,
versus what they can get on Amazon, right?
Yeah.
We are completely held to a different standard.
Absolutely.
What is in that product is in that product. And the chemists who have a way big pay, you know, way big
fancy job,
they develop a certain vehicle or a certain way for the products to penetrate where they need to be.
Exactly.
And not just sit on the surface.
Right.
Mm-hmm. Yeah. So I think that's where a lot of people really don't understand the difference between what we can dispense and what they can get over the counter.
Right. The other thing I think people don't really realize is how unregulated and how much market shenanigans are in the skincare industry. Mm-hmm. Like they can say with hyaluronic acid and literally just put a drop in the whole vat, right?
Yeah.
Versus when we have a medical skincare product, each individual ingredient is exactly disclosed and the amount of it. So you know that there's more than just a drop of hyaluronic acid in the product.
And in turn, that means it's going to work. So I can't tell you how many times people sit in my chair and go, I have tried every single skincare product, nothing works.
Right.
I'm not surprised about that. So again, it goes back to that consultation about, educating them on, okay, this is why it's not working. Maybe it's the complete wrong product.
Correct.
Maybe they needed something, maybe they didn't need a vitamin C and they needed, another active ingredient that was customized to their skin. So again, I think that's where that consultation, that's where that education, that's where that one-on-one time is really important.
Yeah. The other thing I don't think people really consider is these products are widely, if you go to the drugstore, right? Anybody can get in and buy that product.
Correct.
If there's no so none of these companies want to get sued. Nobody really wants to put enough product in there to cause harm, right? So a lot of the products just have too little ingredients to be effective.
Right.
Which is one of the big problems.
And it's all about marketing, right?
Yeah.
It's all about what celebrity can you get to stand by the bottle and say, "Oh, I used this."
Right.
When in turn,
she's getting a facelift, and
they're not using a Vino.
Right. Exactly.
Right. So I think that's another misconception, and our products aren't that much more expensive.
No, and you don't need as much.
And so I think that's also a big fear with people is that, oh my God, I just can't. I can't afford a product there. You actually can, because you're using a fraction of what you would use over the counter.
And probably one serum instead of 12.
Correct. Yeah. So
that's good. Well, thank you for your expertise.
You are very welcome.